Can you all see my screen? Can you all see with the PowerPoint ولا لا؟ Okay, great. طيب, first of all, Assalamu alaikum everyone. My name is Mohammed Naem. I'm a third year medical student, and as I like to say in my lectures, please, all of you call me Naem. So today's lecture, we're going to talk about the endothelium and the platelets. That's the title of the lecture. So obviously we're going to talk about them. This is my email, and also this is my WhatsApp number. So please, you can use them whenever you want. Any questions you have, even if it's not about this lecture, make sure you can come contact me. I'm very open to questions. I advise you to use the WhatsApp number. I reply there way faster than the email. I don't check my email always. So yeah. Okay, let's start. So this is the table of content. This is our objectives. This is what we will talk about. First of all, we're going to talk about the endothelium, its structure, its function. Then we're going to go and talk about the regulation of permeability, and then we're going to go talk about the platelets in details, inshallah. So let's start. First of all, what is the endothelium? So this is a picture that you guys probably saw multiple times, okay? But I want to give it some time to make sure that you guys understand this concept before going more into the lecture. Can you see my pointer? Is my pointer obvious? Okay, so first of all, we have three types of endothelium regarding its structure, and you need to know this concept. First one is the continuous endothelium. Second one is the fenestrated endothelium. Third one is the discontinuous. Are they all the same? Obviously not. For the continuous endothelium, if you look at the endothelium itself and on the basement membrane, you can see it's full. There is no pores, there is no holes. Basically, we need this type of endothelium to minimize the leakage, so that we won't have any leakage regarding fluids, regarding mainly proteins. The leakage, when we talk about leakage, we mainly talk about proteins. So what area in the body that is so sensitive that we should have, like we should make sure there's no leakage at all? The brain. The brain is like one of the most sensitive tissues ever. Anything that leaks to the brain basically can lead to death. So we need to make sure that the vessels there are continuous, basically continuous endothelium, so we won't have any protein leakage, any hormone leakage to the brain that is unnecessary. The second type, we have the fenestrated endothelium. Now, as you see, this is a blood vessel. Again, as you look at the endothelium, there is like a little bit of pores inside the endothelium, but the basement membrane is continuous, okay? So this type of endothelium is going to allow a little bit more leakage. It won't be free leakage, it won't be a lot of leakage, but it's gonna be allow like it's more permeable than the continuous type. So we won't find it a lot in the nervous tissue. We won't find it a lot in the brain. We're gonna find it more in the glands, in the gastrointestinal tract. In these areas where we need to absorb and secrete fluids without doing it, without overgoing, and without secreting more than we should, or absorbing more than they should. The last type, which is the discontinuous endothelium, and as you look here, the endothelial cell itself has pores. It's not continuous, and even the basement membrane, as you see, there's multiple pores in the basement membrane. That's why we call it discontinuous, because we don't have a continuous basement membrane. Okay, so where do we need to find this? In the places when we have a lot of diffusion. So liver, there's so many hormones in the liver, so we will definitely find it there. In the bone marrow, which you guys know by now, the bone marrow is the place where we produce red blood cells and white blood cells. Not all white blood cells, but some of the white blood cells, but mainly it's for blood production. So obviously we should have very leakage type of vessels, so all the fluids can come in and out all the time. And obviously the spleen, again, as you guys probably know by now, the spleen also is related to red blood cells and the destruction of red blood cells. So again, we need it to be very it should have very leakage type of endothelium. Is this clear, this concept? It's a very simple concept. I guess you took it before, but I want to emphasize on it before going through. Okay, so let's go now. Let's talk more. So the endothelium, it's the inner cell of the blood vessel that is basically in contact with the blood. So again, this is a full blood vessel. This is the endothelium, and this is the basement membrane. So it's the inner cell. It's not the basement membrane. It's the inner cell that is in direct contact with the blood. Okay, simple and clear. Second, it has two surfaces. Very important concept. The first one, which is the apical surface, which is the surface that faces the blood. faces the lumen, aka in direct contact with the blood, which is this one. You see this surface, the surface that is like directly, like basically the blood can like touch the surface and go through the surface. It's the surface that is directly touching the blood. The second surface is the basolateral surface. The basolateral surface is this one, the one facing the basement membrane, or the one that faces the interstitium. So basically, it shouldn't face the blood. It's the surface that cannot face the blood. Okay, is this clear? Very simple concept. Two faces, apical, basolateral. That's all what you need to know. Okay, I think we shall move next. Now let's talk about the functions of the endothelium. When I went and I looked to the Dr. Abdul Jabbar's lecture, when I went to Dr. Abdul Jabbar lecture, he wrote 6 full functions. So we're going to take each one of them, dissect it into details, so you can inshallah all understand each single one of these functions. The first one, which is, again, regulation of permeability. This is a very, very important concept. To be honest, you guys took heme before CVP. If you took CVP before heme, you would this concept would be very easy to understand. But inshallah, after this past session, you guys will all understand it. So what is regulation of permeability? First of all, what does permeability mean? Permeability means how possible is it for the fluids and the molecules to go in and out of the blood vessel. This is a blood vessel and this is the lumen. So how easy is it for the molecules and the fluids to go from inside to outside and from outside to inside? Regulation of that is basically the job of endothelium. So first of all, remember this concept. Ions move freely. Diamond endothelium allows the ions to move freely diffusion. Basically, it depends on the osmolality of the blood and the osmolality of the interstitial fluid surrounding it. As simple as that. So ions, Na, calcium, all of those, they move freely throughout the endothelial cells. Okay. Second of all, it inhibits the movement of proteins. This is the main thing that endothelium does regarding regulation of permeability, which is inhibiting the proteins from going outside of the blood vessel. As you know, guys, in the blood, we have so many types of proteins, so many types of enzymes, so many types of hormones that we need to regulate the whole function of the body. So if those go outside, we will have a lot of problems. That's one. Two, it will lead to something called the osmotic pressure decrease, basically our osmotic pressure decrease. Now, again, this is what I was talking about. If you took CVP before heme, this would have been way easier to understand, but I will explain it. So inside the blood vessel, there is 2 types of pressures, okay? We have the hydrostatic pressure and the osmotic pressure. What is each one of them? For the hydrostatic pressure, it's basically the pressure of blood pushing on the arteries, pushing on the vessel wall to go outside. So the hydrostatic pressure, it's the pressure that wants to take the fluid from inside to outside the vessel, okay? It's basically like the hydrostatic pressure, it depends on how hard the heart pumps, what is the resistance of the vessels, all of those concepts. Now, the second one, which we're going to focus about here, which is going to focus on here, it's the osmotic pressure. What is the osmotic pressure? Now, y'all remember in the lecture of osmosis that you took, or the lecture of osmolality that you took, that fluid goes to the places where it has a lot of molecules, the places that have very high osmolality. Fluids goes there, right? Yeah. Basically, we have a lot of proteins inside the blood vessel, as I already told you. And these proteins attracts fluid to come inside the blood vessel, okay? Basically, it creates a pressure to make fluid comes from inside to outside. This osmotic pressure is created by the presence of proteins. Now imagine if the endothelium allowed the proteins to move easily outside of the blood vessel, right? So basically, the free diffusion. Now proteins would go outside the blood vessel and this osmotic pressure would be basically vanished. We won't have anything called osmotic pressure, but we still have the hydrostatic pressure that I told you about, which pushes the fluid from inside to outside. By that happening, we'll have so much less fluid inside the vessels, and actually a lot of the vessels will basically have no blood in them at all. That's why we need to make sure that proteins are staying inside the vessel, so we would still have osmotic pressure. Now let's see it in text. So first of all, blood hydrostatic pressure forces the fluid outside of the vessel. And on the other hand, the proteins create the osmotic pressure, which basically attracts the fluid back into the vessel. Okay, so now if we lose the proteins, we said that the fluid will go outside, right? Because we don't have any force opposing the hydrostatic pressure. So protein is outside, the fluid will stay outside, that will lead to edema. By now, I guess you guys know what edema is, but if you don't, edema is basically excess fluid in the interstitium or in the basically outside the blood vessel. That is what edema is. Now, this is a very important concept. We said that protein creates the oncotic pressure, right? Now, the main protein that leads to the oncotic pressure is a protein that we call albumin. It basically generates almost 70% of the oncotic pressure. Yes, you guys need to know this number. Dr. Abdijab will have to ask about albumin, about this percentage. So please make sure you know this. Albumin generates 70% of the oncotic pressure in the blood vessel. Okay? And again, some proteins need to exit the vessel for inflammation, transportation, hormones, and lipids, and all of it. Basically, now we have lipids, we have hormones inside the blood vessel, right? A lot of them are secreted by glands, and they go, for example, let's say this hormone needs to go to the lung, okay? But we said the endothelium doesn't allow the proteins to diffuse, right? Yeah. Now, some proteins like albumin and other proteins will come and take this hormone and take it by a different method to outside the vessel. Okay, so just for you to know, yes, endothelium does not allow free diffusion, but that doesn't mean that proteins will never get out of the vessel. No, they get, but in different mechanism, not just freely. They don't just diffuse it throughout the endothelium. Is this clear? I know this is a very complicated complex, so I want to make sure it's clear for everyone before I move forward. Is it clear, guys? Okay, clear. Now, again, what is this? So the endothelial cells mechanism, to get specific, again, we talked about there's a specific mechanism. Now, we're done with the first function, which is permeability, which is the regulation of permeability. You guys all said it was clear, so I'm going to move to the second one. The second one, which is regulation of immune response. Okay, again, regulate means it controls. Immune response, it's the response that the body does to attack pathogens and basically foreign microbes that are inside the body. Basically, bacteria, viruses, all of that. The endothelium also has a role in regulating that immune response. How is that? One, basically, we have something called interleukin-1, which is IL-1, and TNF, okay? These two hormones will come to the endothelial cells and affect it, okay? Two hormones or two molecules are going to come to the endothelial cells, and they're going to attach to its receptor, and make changes on the endothelial cells. These changes will allow a specific cell called the leukocytes to go from inside the blood vessel to outside, to the tissue that has the pathogen in it. I'm going to get into more details about that. But for now, please know that there's something called interleukin-1 and TNF. Very important two things to know. Again, there's something called integrins and selectin that I'm going to talk about in the next picture. It will allow us to understand it more. Now, for the sake of this lecture, for this specific lecture, I don't think you guys need to know this, but I'm pretty sure a lot of the doctors, or like in one of the lectures, one of the doctors explained this. So know it from that lecture. Don't know it from here. I'm here just going to talk about the endothelial function. Okay. So now look from here. We have the cytokines, the TNF that we talked about, and interleukin-1. They will go to the endothelium. Okay. Look at the endothelium. Remember the selectin that I told you about? B-selectin and E-selectin. They're going to be visible now on the endothelium because of the TNF. Because of TNF interleukin-1, these selectins are going to appear on the surface of the endothelium. This will attract this leukocyte. You see the leukocyte? It will come and it will bind to them and it will start rolling. Basically, imagine this is the blood vessel and this is the leukocyte. It will come here and it will start rolling on the endothelium till it reaches a molecule that I love to call ICAM, okay? You shouldn't call it ICAM. It's ICAM1, but for the sake of memorizing it, call it ICAM. When it reaches this molecule, integrins that we talked about here, you see the integrins that we talked about right here? Exactly. They are on the leukocyte. Will attach to this ICAM, and then we will have, and then it will adhere. So it won't keep rolling. It will adhere in that place. So first of all, come attach to the selectins, and it will start rolling. When it reaches the ICAM1, it's gonna attach there, okay? When it attaches there, we're gonna have an opening in the endothelium. Look here. Basically, the endothelium is going to open a little bit, allowing the leukocyte to go outside, to go to the tissue where we have the pathogen in. Okay? Basically, it will go to the tissue where we have the pathogen in. Is it clear? Is this process all clear? Do you know now how? Okay, so Okay, sure. I will repeat it. You don't think you took this? I'm not sure if you didn't take it because HLS this year is kind of different than our year. But if you didn't take it, okay, someone said that you guys took it. So maybe you didn't study that lecture yet, but you don't remember it well. Okay, خلاص. It's a tough concept. I'm gonna explain it again. Okay, so we have macrophages or whatever cell in the body that produces interleukin-1 and TNF. Okay, these cytokines, these two molecules that we already talked about, are gonna go to the endothelium. Okay, they go to the endothelium, bind to their receptors, and affect the endothelium. How do they affect the endothelium? They basically allow two molecules, which we call P-selectin and E-selectin, to now appear on the endothelium. If there is no TNF, no interleukin-1, P-selectin and E-selectin won't be there. They will be inside the cell. Now, because of these two cytokines, these two selectors are going to appear on the surface of the endothelium. Now, the leukocyte will come and they will attach to them and they will start roll. They start roll. They keep rolling till they reach a molecule that I love to call ICAM, which is integrin ligand ICAM1. Okay? Yes, I guess you need to know the name if you took this concept. When they reach that place, integrin that is found on the leukocyte. Now we're talking about something found on the surface of the leukocyte. This integrin is gonna basically attach to this ICAM. Okay, when it attaches to it, the cell adhere in its place. So no more rolling. It stays in its place. Now after this happens, the endothelium is gonna open shway. As you see here, it opens a little bit, allowing the leukocyte to go outside. Why do we need the leukocyte to go outside? Again, to go and kill the pathogen that is found in the tissue, because the pathogen is in the tissue, not inside the vessel. Is it clear now? Okay. Okay, I guess then we shall move next. Now we're done with two functions, regulation of permeability and regulation of immune response. Third one, the growth of new blood vessels. Yes, our blood vessel can grow. We can even basically new blood vessels that are not found in that area. We can grow blood vessels to there. How do we do that? Why is endothelium related to that? We will know now. First of all, this process of growing new blood vessels, we call it angiogenesis, and you need to know the name. Angiogenesis. You will never find a doctor saying growth of new blood vessels. It's called angiogenesis. The process called angiogenesis, so know the name, please. So first of all, this growth happens toward the areas that are lacking oxygen. Remember, every single tissue in the body, except like very minor ones that you don't need to know, but almost every single tissue in the body needs oxygen, okay? That's like a rule that you guys know from high school. Every tissue needs oxygen. So if the tissue doesn't get enough oxygen, the tissue will die. That's why we have angiogenesis, to make sure that there's blood vessels always growing to that tissue that doesn't have oxygen, so it can basically supply it, okay? Now, this whole growth is regulated by a growth factor. This growth factor is called vascular endothelium growth factor, VEGF, okay? So first of all, it grows towards the tissues that are lacking oxygen. Second, it's regulated by this hormone. Clear, I guess. Now, let's talk about it in this picture, okay? Let's get more details about angiogenesis. First of all, the tissue that is injured, basically low oxygen injury, or what we call hypoxia, it will release this hormone. So let's see the stromal cells, okay? They don't have any vessels around them. So they release VEGF, or vascular endothelium growth factor, which will go to the endothelium of the blood vessel, okay? It goes to the endothelium of the blood vessel. Sorry. It go to the endothelium of the blood vessel. Now, what will it do? First of all, this is the endothelium, right? Remember, we said we have an apical and a basolateral surfaces. What it does basically, it flips its polarity. It flips the polarity of the endothelium, okay? So the apical becomes basolateral and the basal becomes apical. Why is that? We will know now. Second. So first of all, flips the polarity. I'm going to explain it more, but let me finish it all in one go. Second, you remember the junctional complex between the endothelium cells? You guys probably took it. There is junctional complex and adherent junctions between the endothelial cells, right? Now, this growth factor will go to these basically junctions, and I don't want to say destroy them, but it kind of does, okay? It kind of basically make them weakened so the cells can separate. So basically the cells can separate, okay? So this is the second thing. Third thing, and the final step, the cell now, the tip of the cell is going to start invading. So again, this is an endothelium. Clear? We're going to flip the polarity first. Second, the complexes are going to weaken. Third, now the cell will start to invade. Look, it will start to invade inside the tissue that produces the vascular endothelium growth factor. As you see here, this was a vessel. Then we flip the polarity, we broke the junctions that were here, and now we're invading toward the tissue that basically, we're invading toward the tissue. We're basically invading toward the tissue that produces the vascular endothelium growth factors. Okay, now what do we mean by flip its polarity? To be honest, it's kind of complicated. So in my opinion, just memorize it, but I will explain it what it means. Remember, we have apical and basolateral surfaces, right? The apical is the one that faces the blood, and the basolateral is the one that faces the tissue, right? We said this is the rule, always apical, blood, basolateral faces interstitium. Now when we want to open a new vessel, right? The apical surface will stop facing the interstitium before there's blood. And that shouldn't happen, never happen, because it will lead to a lot of complication. So the subhanAllah, we were created in a way that angiogenesis, before it opens it, it basically flips the polarity. So the apical surface will start acting as if it's a basolateral surface. It will start having the same proteins on its surface. It will start acting exactly the same as the basolateral surface. So it can start invading the endothelium. So it can start invading the surrounding tissue. Is this clear? Okay, great. Everyone's saying it's clear. Right. Now in this case, we talked about stromal cells, basically the normal growth of cells, an area that doesn't have oxygen. Now let's talk about a little bit more complicated one, which is when we have tumor cells. Okay. What is tumor cells? What is a cancer? A cancer is basically a number of cells dividing so rapidly that the body can't control it. And it will start creating these masses. Now remember, the cancer keep growing, right? So it start demanding more oxygen, basically because it's bigger than it should in an area that it shouldn't be. So there won't be enough supply for these tumor cells of oxygen. Now, you would think that this is a good thing, which is actually yes, because the tumor cells should die if there's no oxygen, right? But this cancer thing is a really dirty disease that even these tumor cells, when they become big and they start being hypoxic, they will stop even producing the vascular endothelial growth factor, which will go to the basically the nearest blood vessel, go there and lead to another growth of a blood vessel toward this cancer. Okay, so now the cancer actually is demanding the body to grow a blood vessel toward it so it can get the supply of basically oxygen and all the other things that our blood brings. So basically, the tumor, yes, our body is using this angiogenesis process to become bigger and bigger. It's a really dirty disease. Now, thanks God, humans are smart enough to notice this, and they came with a drug. Okay, now think with me. Imagine this tumor cell is growing, right? And now it's bringing blood vessels to it. What is an easy way to kill these tumor cells? Is basically to stop these blood vessels to coming from it, right? So they won't get enough, they won't get more oxygen. They won't have the same supplies that the blood does to all the tissues. So the tumor cells would die, right? So how do we do that? Basically, the scientist came up with an antibody to this hormone. So an anti-vascular endothelium growth factor, which is called Avastin. I don't think you need to know the name. I'm not sure, Salaha. Know it for better, Yani, which is basically a treatment to slow the growth of the tumor. Basically, this antibody will come and it will bind to this growth factor and it will stop its function. So now the tumor can get more oxygen supply. So sadly, the tumor cancer is way bigger than just dying from one antibodies. One treatment. Tumor is way worse than that. You will get to know it by second year, inshallah. But yeah, like it's a good way to slow the growth of tumors. Is this clear? Do you guys understand why now angiogenesis is related to tumors? Okay, we shall move next then. Okay, yeah, this is a checkpoint. Please, if anyone has any question regarding all the first 3 points, make sure you ask me. No questions? Okay, we shall move next. Now, the fourth function of the endothelium. Basically, it detects the blood pressure changes. So what is blood pressure? Again, this is a concept. If you took CVP before him, it would be easier, but I'm going to explain it. Blood pressure, in the most simple terms, is the amount of force that the blood puts on the blood on the vessels wall. So remember, the blood is pumped by the heart, right? To go through the whole body. So it's pumped by force. If this force increases, the blood force on the vessel wall would increase also, which will lead to higher blood pressure. That's basically what blood pressure is. Now, what is the role of endothelium? What is the cell of the vessel can do about that? Basically, it can detect this, okay? Remember, if we're putting more pressure inside the blood, that means the vessel will start stretching, صح? It will start stretching a little bit. This stretching is detected it's detected by the endothelium cell itself. When the stretch is detected, the endothelium will release a molecule called nitric oxide, NO. Nitric oxide. This is not NO, this is NO, nitric oxide. Basically, a molecule produced by the body that helps the body relax its muscles. So again, this is a vessel, it's surrounded by muscles, right? And there is very high pressure of blood coming now into this blood vessel. So imagine if those muscles are contracting on high blood pressure, at the end, this vessel is going to collapse and get destroyed, right? We don't want that to happen. So the endothelium would detect this increase in blood pressure and it will release nitric oxide to the surrounding muscle. So the surrounding muscle would relax and the vessel will start stretching even more so it can accumulate more blood. Very clear concept, Salaha. I don't think I need to repeat, but if you guys didn't understand, please start. Clear? Move next. Could you explain this point again? Okay. So the blood is pushing, the heart is pumping the blood with force, right? The ventricles contract and they're pushing the blood with very big force on the vessels. Now, for whatever scenario, the heart could pump the blood with bigger force, right? Which means the blood now is moving faster and more aggressively in the blood vessels. Because they're moving like that, they're gonna basically put a lot of force on the vessel on the vessel wall, which is the endothelium cell. The blood is going to go through and put more force, which is going to lead the endothelium to stretch a little bit. This stretch is considered a stimulant. Basically, the endothelium can detect this stretch. Now, we have high blood pressure going inside the arteries, and the muscles around it is contracting, right? They're basically pushing on the vessel command. So, pushing from here and pushing from here, that will lead the vessel to collapse. So, alhamdulillah, the body is smart enough, and the endothelium cell is smart enough to release what we call nitric oxide. This thing is called nitric oxide, a molecule that the endothelium release to the muscles surrounding the vessel. It will lead these muscles to basically relax a little bit. When these muscles relax, the vessel can stretch now even more, so the vessel won't basically collapse because of pressure from inside and outside. It's just like a protective mechanism. So NO decrease the blood pressure. I'm not sure. So it kind of does. It kind of does. Yeah. NO decreases the blood pressure because it decreases the resistance. So it kind of does. Yes. Because it basically allows the arteries to accumulate and stretch more. Yeah. Okay. Now we're done with the fourth point. It was a very quick one. Let's now talk about the fifth function, which is regulating clotting. Okay. Which basically regulate clotting. By the way, I was saying nitric oxide? Oh, wait. Okay, forget about it. So let's talk now about the regulation of clotting, which is the fifth function. Which is the fifth function of this thing, okay? First of all, one thing that always the endothelium does is inhibit platelet aggregation. You guys know what platelet aggregation is? Basically, it's when the platelets come together and bind to each other to make a clot. So the first function of the endothelium regarding this point, it inhibits this platelet aggregation. In a normal case scenario, endothelium does not allow this platelet aggregation to happen, okay? Why is that? Because if we're talking about a normal vessel, no injury, imagine if the endothelium was helping us on the platelet aggregation. That will lead to one thing, which is basically clots everywhere, and basically you would die because the blood can't go anywhere because all the blood is clotted, right? That's why endothelium, what it does, it inhibits this platelet aggregation. Second thing that it does is when there is an injury, so we're talking about abnormal case scenario, when there is an injury to the endothelium, it secretes the VWF factor, which basically helps in the clotting cascade. I'm going to talk about it later, not now, okay? But for now, no, in a normal case scenario, it inhibits the platelet aggregation, and when there's an injury, it secretes the VWF factor, which is one Willebrand factor, okay? Now, let's talk about the antithrombotic properties of the endothelium. First of all, what is the meaning of anti? And guys, this is an advice in medicine in general, especially that you're still in your first year. Always, when you see a long word, it's definitely a word that you can cut into multiple pieces to understand its meaning, okay? So let's cut this one down. Anti means it prevents it from happening, you know? Thrombo means a thrombus, a clot. Pytic, which basically means antithrombotic, it doesn't allow a thrombus to be formed. As simple as that. Now, what does the endothelium do to lead to this? Okay, not one. It's antiplatelet properties now. First of all, okay, I don't know why it showed all one in one go, but okay, let's talk about them one by one. It covers the basement membrane. Remember when I showed you the first slide? There's a basement membrane, and inside it, there's an endothelial cell, right? Okay, the basement membrane is a structure that if it gets exposed to the blood, if it gets exposed to the platelets, it will start making clots directly. The moment that basement membrane is exposed to the blood, you will see a lot of thrombosis happening, a lot of clots happening everywhere. So one of the functions of endothelium is actually covering this basement membrane so no blood can touch it. Clear? Okay. Now remember, as I told you, uninjured endothelium, so a normal endothelial cell will never bind to platelets. Okay, normal endothelial cells shouldn't bind to platelet. That's why it inhibits aslan the clotting process. Okay, now how does it do that? One, by prostacyclin. Two, by nitric oxide. Okay, so prostacyclin and nitric oxide. Again, we're talking about nitric oxide again. So prostacyclin and nitric oxide, they inhibit the platelet binding. They do not allow platelets to bind to each other. Okay, so first of all, covers the basement membrane. Second, it doesn't bind to platelet itself at all. Third, it produces and releases prostacyclin and nitric oxide, which does not allow the platelets to bind to each other. Okay, so these are the first three. The fourth one, ADPase. It has something that we call ADPase. Basically, ADPase counters the platelet aggregation effect of ATP. Okay, ADP is a molecule that leads to platelet aggregation. Okay, ADPase is an enzyme that cuts down ADP, basically decreases the amount of ADP in the body. So if ADP increases aggregation, ADPs would decrease aggregation by decreasing ADP. Is this clear? Okay. Okay, everyone's saying this clear. Tamam. From this slide, wait, can you repeat the point? Okay, the ADPase point. Okay. Now, guys, I want you to know, and we're going to get into more details later, but for now, ADP, okay, this molecule, basically, it's a prothrombotic molecule, which means it wants the platelet to aggregate. It affects the platelets in a way to make them aggregate, okay? That's ADP. Okay, that's ADP. For ADPase, it's a molecule that cuts down ADP. So we have ADP and ADPase. ADPase comes to ADP and it cuts it down. So we won't have ADP anymore, which means ADP won't lead to platelet aggregation. Is it clear this point? Okay, repeat the third point. Tamam. Now, we said that platelets, tamam, produces two main hormones or enzymes or protein, whatever you want to call them, prostacyclin and nitric oxide. These two molecules, okay, they are produced and released from the endothelial cells. Now, from the uninjured endothelial cells, obviously, okay? These two things, we're gonna go to the platelets now. When it goes to the platelets and binds to the platelet, they will make the platelet, like they will inhibit platelets binding to each other. Because remember, when forming a clot, the platelets need to clump with each other, right? So they can form a big clot. These two things, nitric oxide and prostacyclin, they are made from the endothelium itself. And because they're made from the endothelium itself, they go to the platelet and inhibit this aggregation. So basically, platelets now can't bind to each other. They will be separate all the time. So no clot will be formed. Is it clear now? Okay. Guys, remember, all these points are in the case where endothelium is not injured. We're talking about an endothelium that is not injured, a normal endothelium. Okay. Now let's move to the sixth and the last function of endothelium that you need to know. Basically producing enzymes that modify plasma proteins. Now there is a concept that is that all we don't have to know? Is that all? You mean if you mean the details, which details are you asking about? If you mean the details of clotting, no, we're gonna come to it later. Oh yeah, okay, no. So again, endothelium produces. Before we talk about the endothelium, I need you to know that not every protein in the blood is in its activated state. A lot of proteins in the blood are inactivated. For example, let's say a protein or an enzyme that needs to, or a hormone that needs to go to the lungs. Okay, its function is in the lungs, and let's say that it's produced in the kidney. Okay, we don't want this hormone to affect the whole body. So the kidney would release it in an inactivated state. When it reaches the lung, it will get activated. Now, they're telling you here that endothelium, it produces these enzymes that changes these proteins from inactivated to activated. Basically, let's give an example. Angiotensin converting enzyme. Before we talk about the enzyme itself, in the kidney, okay, there is basically in the kidney, there's a hormone produced called angiotensin 1. Okay, it's a vasoconstrictor. This angiotensin 1 will go all the way through the blood till it reaches the lungs. When it reaches the lungs, there will be a hormone produced by endothelial cells called angiotensin converting enzyme. Converting means it changes. So it's going to change angiotensin 1 to angiotensin 2. That's, by the way, this is just an example. The doctor wrote it, and the doctor put it in his slides. I'm not sure if he's going to ask you about it. To be honest, he shouldn't, because it's not the point. You will learn more about it in renal. But just know the fact that there is enzymes that modify plasma proteins that are produced from the endothelium. Is it clear? I think we only have a checkpoint after this. Are you all inshallah smiling like this blood vessel? Everything is clear? Okay, great. We shall move next then. Now, we are done with the first objective of the lecture. Congrats all. We're going to now talk about the second objective of this lecture, which is the regulation of permeability. Yes, I know we talked about it a little bit, but now we're going to go into actual details because this concept is one of the most important concepts like in whole heme. So you need to know it. First of all, what are the four main compartments that play a role in the regulation of permeability of endothelium? One, the structure of the endothelium itself. As simple as that. The structure of the endothelium definitely affect the whole process. Two, the basement membrane, okay, which surrounds the endothelium from outside. Third is a structure that we call the glycocalyx. I'm not sure if you took it before, but even if you didn't, don't be worried. We're going to explain it well in this lecture. Four is basically the intracellular junctions between the endothelial cells. Okay, so these are just the names. Now we're going to go into details. First of all, the continuous endothelium restricts the diffusion of protein. The first thing that I talked about in this lecture, continuous endothelium does not allow protein to diffuse outside the cell. Again, all of this that you see here is just explanation to this concept. I said it before. I explained it before, so I don't want to waste your guys' time. if you want, I can go over it again. What do you guys want? This is basically, if you go and read it, it's exactly what I said at the start of the lecture. So do you want me to go over it again? Well, let's go on. It's understood. I just wanted to put it in text so when you guys come and like read the PowerPoint, you guys can remember. Okay, I guess I will move on then. Okay, so basically I want you guys to see this. This is the continuous endothelium that we talked about. See, this is a picture in what we call an electron microscope. You guys know it by now. This is the endothelial cells, as you see, and this is the lumen. This is where blood is. As you look with me. There's not a single pore. It's continuous. There's not a single opening between the endothelium. Look, completely continuous. Clear? It's a very good image. I think Sarah, you need to know these images, by the way. I got them from the doctor's lecture, the exact same picture. So I think you guys need to know this, okay? Again, this is the endothelium nucleus, just if you want to know it, yani. It's the biggest part. It's very obvious. This is the lumen, okay. Now let's talk about the basement membrane. This is, I don't want to say a hard concept, but a concept that I need you guys to focus with me. So inshallah, it can get easy. But yeah, please focus with me when I'm explaining this. Now, first of all, okay, they all appeared one go. That's not cool. Anyway, so the first thing I need you to know that the basement membrane is negatively charged. So the basement membrane that surrounds the endothelial cell is negatively charged. Why do we need to know that? Remember at the start of the lecture when I talked about albumin and I talked about proteins and that we need to keep them inside the cell, inside the lumen? Yeah, here it comes again. So albumin in a normal state of the body, remember guys, whenever we're talking in first year, if we're not giving you, if the doctor is not talking about a syndrome, about a disease, then he's talking about the normal physiological state of the body. So at the normal pH, albumin is negatively charged. What does this mean? So this is a lumen, okay? This is the blood vessel and this is the basement membrane. Albumin is negatively charged. The basement membrane is negatively charged. So imagine now, albumin wants to get outside. What will happen? They will repel, negative and negative, they will repel. So it will prevent albumin from going outside. That's another mechanism just to make sure that albumin is always inside the blood. Basically, the protein is negative, the basement membrane is negative, so they will repel when albumin tries to go outside. So albumin is going to stay inside. Is it clear? It's basically repelling. Any negative, they repel. It's like if they're positive, they repel. That's the whole concept. SubhanAllah, God created us in such a way that it's fascinating. Okay, now that's just like a quick info to know. In the kidney, which basically where our blood is changed to urine. Now, definitely proteins is something that is very valuable for the body, so we don't want to lose them, okay, in the urine. So in the kidney, we have very thick basement membranes. So which means very big negative charged, like a negatively charged membrane to make sure that these proteins won't go into urine and we won't lose them in urine. It's just like a quick info. But to be honest, just know it. It won't take you seconds to memorize, inshallah. Now, we talked about the endothelial cell itself. We talked about the basement membrane. Again, oh yeah, this is just, again, another picture. This is the basement membrane that we have been talking about. This is, again, an electron microscope. And I think you need to know this picture. صراحة, it might come in the OSPE. I think in our year, yeah, man, the last year it came in the OSPE. I'm not sure, but yeah, you need to know this. Okay, so this is the basement membrane. This is the nucleus again, and all of that. Okay, so we're done with the first two structures. Let's talk about the third one, glycocalyx. Now, what is a glycocalyx? First of all, the mechanism of a glycocalyx is very, very simple to the basement membrane. It's basically a brush-like structure, okay? Let me show you the picture. So this is a glycocalyx. You see this? This is what we call these hair-like structure, this brush-like structure. This is what glycocalyx is. Okay, what is the function of a glycocalyx? Like just the basement membrane, it's negatively charged. So again, if you have protein here trying to go outside of the cell, they will repel and the protein will stay inside of the cell. As simple as that. Basically the same concept of the basement membrane. Glycocalyx is a negatively charged structure that is made from proteoglycans and other GAGs and proteoglycans. You need to know this and you need to memorize this. But the main concept that it's negatively charged, which means it won't allow proteins to get outside. Same concept. Now, we have some enzymes in the body and some diseases will lead to the removal of glycocalyx. This layer will get removed. Like in this case, you see, we don't have glycocalyx. What will happen? Some of the proteins will leak to the outside, right? And as you see here, we have so much fluid outside the basement membrane. You look here, so much fluid. What do we call this? This is edema. This is basically edema. Excess fluid in the interstitial spaces. You see, we don't have a glycocalyx, it led to edema. Directly, as simple as that. No glycocalyx, it led to edema. There is a glycocalyx, there is no edema. Is the picture clear? You guys can differentiate? Okay, great. Okay, this is صراحة the part I hate the most about this lecture, which is the junctions between the cells, because I explained this lecture to so many people, but like there's nothing to simplify here. It's just that you guys need to know them, but we will try our best. Okay, so first of all, remember, endothelium is a continuous endothelium, right? So definitely nothing, no proteins can get from outside the endothelium, right? It's continuous. Now we have two endothelial cells beside each other. This is an endothelial cells, this is an endothelial cells. They are sticking to each other. What hold them together? Basically, what holds them together is junctional complexes. Okay, so this place where they hold together, that is the only place possible for diffusion to happen. So diffusion can't happen across the endothelium. It only can happen in these junction places where two endothelial cells come together. Okay, clear? So this is the place where diffusion is only allowed. And at the same time, it's not freely allowed. We will see now. Second of all, we have tight and adherent junction. Okay, so for these two things to be attached together, we have tight and adherent junctions. Okay, basically, these two tight and adherent junctions won't just stick the two endothelium together, but it will also restrict the paracellular diffusion. Basically, it restricts the diffusion. Again, there is no free diffusion, no matter what. We can't allow the blood just to go outside like it wants. So again, it restricts these tight and adherent junctions restrict the paracellular diffusion of molecules. Now, again, most endothelial cells allow the passage of ion. Okay, we said this before. The endothelial brain express. Yeah, we talked about this before that ions are freely allowed to move, but bigger molecules they shouldn't be allowed to move. Okay. Now, again, remember when I told you in the brain, it's a very sensitive tissue, so no leakage should happen there ever. Now they're telling you here, the brain express a lot of this molecule that called claudin 5, which is a molecule. It's a type of the tight junctions. It's a molecule that forms a tight junction. So in the brain, we have a lot of them to make sure that there is no leakage at all. This is a concept that you just need to memorize. Basically, brain is sensitive. Nothing should get there. Brain, any molecule could get to your brain, it'll probably dead. So this is, again, that's why we have excess of quadrillin 5, and other molecules that make sure there is no free leakage. Again, this is just talking about the functions of each one specifically. So basically, the VE cadherins, they basically meditate the endothelium adherence, and they make them very restrictive. Cadherins prevent the fluid from the fluid loss from the vessels. Again, I genuinely hate this part. It's just pure memorization. Now, this is a point again that I need you to understand. Now, we said we have these adhesion junctions and disc adherence, right? Holding the endothelium cells together and preventing them from going outside and inside. طيب, I mean, preventing fluids from going through them. Now, imagine if there's antibodies going to these specific proteins that make the adhesion junction and destroys them. What will happen? Leakage, right? What does leakage mean? Edema. Basically, edema is going to happen because there is leakage and fluid is going outside to the interstitial fluid. As simple as that. It's just as that simple. Is it clear? Again, these are the tight junctions in all the molecules, and these are the VE cadherents that basically make the adherent junction. And this is the cadherent that we said it basically does not allow any fluid passage. I hate this part because there's not a lot to explain. It's just memorization. But is it clear, guys? يعني صراحة you just need to put some effort here and memorize each single one of them. الله يعينكم يعني. Okay, shall I move next? Okay. Now, okay, we talked about the concept where proteins and hormones can just diffuse, right? Does that mean that proteins are always inside the blood vessels? Obviously, no. We need proteins to go to specific organs. We need hormones to go to specific organs. How is that done? That's done by a process that we call transcytosis. I think you guys took this before, but I'm gonna re-explain it. Transcytosis is basically mediates the movement of proteins inside the endothelial cells. First of all, again, we said endothelium restricts the passage of albumin, okay? But at the same time, albumin is a molecule that we call a carrier protein. It's basically takes a lot of hormones and basically drives them to the specific location the body wants them to be there. So look with me at this picture, This is the lumen, this is the outside tissue. Now, you see these proteins and these hormones, they will go to the endothelium. They can't just diffuse. No, they will make a vesicle, okay? And they will move with this vesicle all the way to the other side. And we will basically allow these proteins now to go outside. Okay, why do we need this? Why does the body like allow transcytosis but doesn't allow diffusion? To make it as simple as possible, transcytosis is a process that we can control. Okay, we can basically control the number of vesicles. We can control what proteins we want to be outside, what proteins to be inside. But if it was diffusion, it will be just very random, a lot of molecules just moving in and out. So that's the whole point of transcytosis, just to make sure that the proteins that we need to be in are in, and the proteins that we need to be out are out. Okay, it's just a way of delivering protein across the endothelium. Is this clear? Very simple concept. This is a checkpoint. I hope you didn't get tired. So it's been like what, 40 minutes? Okay, let's move next. Now we're going to talk about the last objective of this lecture. So we're done with endothelium and we're done with the regulation of permeability. Now we're going to talk about platelets. So first of all, where are platelets synthesized or formed? In the bone marrow. Very simple. How many of them do we have? 150 to 450. Okay, thousand. Yeah, 150,000 to 450,000 platelets in the body. Not in the body. I mean by in every this thing. I forgot what was its name. Microliters, in every microliters. Okay. Now, the production of platelets, it's regulated by a hormone that we call thrombopoietin. You guys probably took it by now, but yeah, there's a hormone that is produced from the liver and from the kidney that we call thrombopoietin. It basically stimulates the the synthesis and also the release of platelets. Okay, pure memorization. Just know the name of the hormone, the function which is stimulating the release, and from where does it come, from the liver and from the kidneys. Okay, now 30% of the platelets are sequestered in the spleen. So 30% we find them in the spleen, and 70% of them are at the rest of the blood. Okay, so 30% of platelets are just in the spleen, and 70% are in the whole body. Again, just numbers that Dr. Abdul wants you to memorize. So yeah, memorize them. Again, it's 2 to 4 micrometers in diameter. I don't think you will get asked about this, but just I put it here to be complete. But you need to know this, which is the lifespan. It's from 8 to 12 days. 8 to 12 days. Really, really, really important concept. You will get asked about it. I can assure you, you will get asked about this in whatever way. The lifespan of a platelet is 8 to 12 days. This is very important to know. And something else very important to know, it doesn't have a nucleus. Okay, just like an RBC. RBCs don't have a nucleus. Platelets also don't have any nucleuses. Clear? Okay. Now, these are everything that you're gonna find in the platelet cytoplasm. So we're talking about actin and myosin. We're talking about enzyme synthesis, storage for calcium. We're talking about synthesis of prostaglandins, dense granules, alpha granules. We're gonna talk about these granules later, but again, they're just like pure information to memorize. These are a couple of stuff in the platelet. Now I'm gonna talk about their function. Okay, so first of all, this is the platelet, okay? We divide it into multiple zones. Peripheral zones, organelle zones, and multiple membrane system. We'll talk about that later. But we need to focus here on the membrane zone and the organelle zone. Okay. So first of all, the peripheral zone. It's responsible for platelet adhesion and aggregation. Platelet adhesion and aggregation. Does anyone know the difference between adhesion and aggregation? You guys know the difference or not? Okay, you don't know. So basically, yeah, I will say anyway, but I just wanted to know if you know it or not, so I can go into more details or not. But yeah, I'll go into more details. Okay, aggregation. Oh, aggregation is between exactly yes, aggregation. No, adhesion. No, that's not true. Okay, not exactly. Aggregation happens between platelets. Okay, so a platelet and a platelet when they come together and bind together, that's what we call aggregation. Okay, so platelets binding together is aggregation. Adhesion is the platelet binding to the basement membrane. Okay, so adhesion, a platelet binding to the basement membrane, it get adheres to it. Aggregations is when multiple platelets come together and bind to each other. Is that clear? The difference? So adhesion to basically to the vessel wall. Aggregation is between the platelets itself. Okay. Now, first part of the peripheral zone, again, our friend the glycocalyx. Hi again. It's basically the negative code that we said is around that it's a negative code that we find in the vessels, but it's also found in the platelets. Okay. So what glycoproteins does it contain? Because remember, we said the glycocalyx is made out of glycoprotein and GAGs. So in the case of platelets, okay, in the case of the platelets, what does this glycocalyx has? First of all, you see this list? It is so important. Yeah, I'm not saying that you will get asked about it. I'm actually like I'm not sure how many questions there will be about it. These things you guys need to memorize like it's your name. Genuine, very important concepts. These 4 lines, I'm gonna explain them in more details in the next slide, come on, but you really need to know them. Really need to know them. If you didn't understand anything in this lecture, please know these. Okay, you will get asked about it. I can assure you you will. First one is glycoprotein, but glycoprotein 1b. Okay, so glycoprotein 1b, where do we find it? On the surface of the platelet. That's one. That's we're done with the location. What is their function? It binds to the VWF factor, the von Willebrand factors that we talked about. Remember? Remember the factor that we talked about that the platelets produce when they are injured, the VWF factor. So now glycoprotein 1b binds to this VWF factor. Where is this found? It's found on the collagen of the basement membrane, right? So what will this lead? When something on the platelet binds on something on the vessel, what is this mechanism? Adhesion, right? This is what we call adhesion. So the first molecule on the platelets that lead to adhesion is glycoprotein 1b. Glycoprotein 1b binds to the VWF, the von Willebrand factor. Basically, these two molecules binding to each other leads to adhesion. Now, the second thing is that we find on the surface of the platelets, it's glycoprotein 2b3a. I know it's a weird name. Wallahi, I know it's a very weird name, but Allah income, you just need to memorize it. Now you see this molecule, it's found where we said on the platelet surfaces, right? And I can tell you this molecule is related to aggregation, right? Aggregation, we said it's between the platelets. So this molecule is going to be found on the two platelets that is going to get aggregate. So it's going to be on the surface here and in the surface here. But these two molecules can't just bind together totally. They can't directly bind to each other. You get me? So what will happen is we will have a linkage between them that we call, wait, where's that slide? Yeah. You see this? This is a glycoprotein 2b3a and glycoprotein 2b3a between the two cells. They don't bind directly to each other. There is fibrinogen that binds them between. They basically this bind to a fibrinogen, this bind to a molecule called fibrinogen. Both of them bind to the same fibrinogen, so they aggregate. Is it clear? I know it's very confusing. So the first one related to adhesion, glycoprotein 1b. This one. Look, it binds to the VW factor or von Willebrand factor. As you see here, it binds here and it leads to adhesion because the platelet is binding to the vessel. When it binds to the vessel, it's called adhesion. Now, for aggregation, glycoprotein 2B3A, which is found on all the platelets, as you see from here and here, two platelets together, they bind to the same fibrinogen throughout this glycoprotein, which lead to aggregation. Okay, is this clear? Is this concept clear? It's very complicated. Wallahi, I know. But is it clear? Because it needs to be clear. Clear? Okay. Type. So could you maybe go through it one more time quickly, please? Okay, I will go through it, but I will go back to that slide and explain it one more time from A to B. But let me finish all these things before, then we can go to it. But I will definitely go over it again. I was planning not to. Type. So again, so the first thing we have on the platelet, glycoprotein 1B. The second thing we have on the platelets is glycoprotein 2B3A. Okay, we're done with the first two things. Third thing is a receptor that binds ADP and thrombin, promoting aggregation. Remember when we said ADP is related to aggregation of the platelets and ADPase would decrease it? Okay, now we're talking about ADP itself. We're not talking about the ADPase. We're talking about ADP. So receptors on the platelet would bind ADP and thrombin. Thrombin and ADP would lead to platelet aggregation. Okay, so thrombin is a molecule that binds to the platelet and lead to platelet aggregation. Is this clear? Thrombin binds to the platelet, it leads to its aggregation. As simple as that. Okay, so we're done with the first three molecules. Glycoprotein 1B, glycoprotein 2B3A, and the receptor that binds ADP and thrombin. Now, the last thing that we have on the surface of the glycocalyx is factor 1, 5, and 7. Okay? 1, 5, and 8. Sorry, not 7, 8. 1, 5, and 8. These three factors are found on the surface, and again, their whole function is clotting, and they're basically, guys, all of this are related to clotting, whether it's adhesion or aggregation. All of this are related to that. So please know this. Anything on the surface of a platelet, it's always about aggregation and adhesion. It's basically about clotting most of the time because that's the main function of platelets. Okay, so this is the first four things in the glycocalyx. Okay, now, second of all, membrane exposed on platelet activation. Basically, the membrane of the platelet will be exposed on the platelet activation. There is basically okay, so the membrane, okay, has something on its surface called platelet factor 3, okay? When this factor interacts with plasma coagulation factors, which are these three factors that I talked about, 1, 5, 8, and any other or any other factor like thrombin or any other thing in the body that basically lead to aggregation. When this platelet factor 3 interacts with it, it's going to produce a very, very, very important molecule that we call thromboxane A2. Thromboxane A2, a very, very important molecule that you need to know for your exams. Thromboxane A2. Again, thromboxane A2, it's very important. You need to know it. So this thromboxane A2 is going to get released when platelet factor 3 on the surface of the platelet interacts with plasma coagulation factors. What does this factor does? Again, it stimulates aggregation, just like thrombin and ADP, and vasoconstriction. So vasoconstriction and aggregation. Vasoconstriction and aggregation. Is this clear? Is thromboxane A2 clear? What is the function of it and when is it released? See, yes, okay. Okay, great. Vasoconstriction and aggregation. Yes, vasoconstriction and aggregation are the function of thromboxane A2. Thromboxane A2 is very important. You guys, I'm gonna talk about it later, come on, just to make sure that you guys memorize it. Okay, now we're gonna talk about the second zone, which is the organelle zone. Again, there's not a lot to explain here. It's mostly memorization, but I will try to do my best. Okay, so for the organelle zone, okay, in the platelet, we have three types of storage granules. You know what a granule is, right? It's like basically a big circle inside like cells that acts as a storage. So in the platelets, we have three types: alpha granules, dense granules, and lysosomes. Okay, for the alpha granules, basically they contain multiple things. One, clotting factor, the VWF factor that we talked about, the platelet-derived growth factor, and other proteins. Okay, so it contains 1, 2, 3, 4. You need to memorize them. صراحة, I can't help. For the dense granules, they are less common inside the platelet. So you should know that alpha granules are more common than dense granules. Like, what does dense granules contain? They contain the ADP that we talked about, ATP, which is the source of energy, serotonin, and calcium. Serotonin and calcium. Clear? Okay, so this is the second type. The third type, which is lysosomes. You guys probably know what a lysosome is by now. It's basically a granule inside the body that contain hydrolytic enzymes. When protein gets there, they get chopped down so the body can use them for basically, they can use these proteins and these molecules for nutrition. Okay, so three types: alpha, dense, lysosomes. Just know what each granule contains, and inshallah you will be fine for the exam. Is it clear? Okay. So platelets. Oh, it says again. Yeah, this is basically nothing. Okay, yeah. Now let's talk about how do we activate a platelet. Okay, so first of all, remember our beloved molecule ADP that we have been talking about all day. This is a platelet and this is an endothelium. So ADP will come now here. Okay, when it comes, wait, what's happened? Okay, yeah. When ADP comes, it's gonna bind to the receptor. Its receptor on the platelet that we talked about. Okay, comes and goes through a lot of reactions that I don't expect you to know. Okay, a lot of these reactions at the end, they're gonna produce what we said, thromboxane A2. You see, it produces thromboxane A2. Now look at this molecule. It's very unique. It will come from inside the platelet. It will be released to outside of the platelet just to bind to the receptor. So aslan, it is inside the platelet, but it's gonna get out so it can bind to its receptor so it can express its function. Okay. Now, what is the function of this thromboxane? Okay, read with me. It binds to the membrane receptor. Okay, it inhibits adenylyl cyclase. This molecule, as you see, is going here and it's inhibiting it. Okay, this releases calcium. Guys, remember calcium? What does it does? Calcium, it basically reads for contraction of actin and myosin. You guys know that, right? Remember, inside the platelet, we also have actin and myosin. So basically, by inhibiting adenylyl cyclase, calcium will be released inside the platelet. What will this lead to? This will lead to contraction of the actin and myosin, which is basically the platelet activation. So thromboxane, when it binds, what will happen? When it binds, it's going to lead to decreased activity of adenylyl cyclase. When there's a decreased activity in adenylyl cyclase, basically calcium will be released. When calcium is released, there's contraction, and this contraction leads to platelet aggregation. Now, again, everything is written here, and I'm just saying collagen, epinephrine, thrombin, all of these molecules that could lead to platelet activation other than ADP. Again, ADP, it's usually released from damaged RBCs. So, yeah, just for you to know, if you got an injury to your hand, you got a cut, okay, and ABCs and RBCs definitely got damaged, right? So what will happen is the ADP, when it get damaged, it will be in the blood and it will attach to its receptor and lead to platelet aggregation. I mean to platelet activation, which will lead to close this. What about BF3? You mean the factors that we just talked about, Juan? The platelet factor? You mean this one? Yeah, this one. Okay, this one, it leads to thromboxane synthesis, which is very. It's basically the same. There's a lot of. By the way, I'm not sure if this one specifically in this picture is the same one, but yeah, it's basically the same. Both of them lead to thromboxane A2 production. So this could be the same as BF3. It could be the same receptor, you know. So yeah, probably that is it. But I don't want to tell you that this one specifically it is it, because it could not be, and I don't want to screw you up. But my point is, no, no, yes, it's the same function. Both of them will lead to the production of thromboxane A2. Clear? Hold on, guys. Like another probably 3, 4 slides, and we're done. Okay. Is everything clear now? Okay. Okay, now I'm gonna re-explain this concept again because it's really, really important. Okay. Now, well, I'm gonna go into more details now. So you have the blood vessel, okay, in your hand. You get injured. Hello? You get injured in your hand. Now blood is leaking. We need to stop this blood from leaking outside. So what will we do? What will happen like basically is like this. Because of this injury, a lot of these thrombin, ADP, all of those are gonna go and bind to the platelets and activate it. When it activates it, what will happen? First of all, because of the injury, a lot of the time, the collagen, or most, not a lot of the time, basically every single time, the collagen in the basement membrane get exposed. And remember when I told you this basement membrane really leads to a lot of clotting? Why is that? Because it has the VWF factor on it. Now look, this is the VFW factors that is on where? On the vessel wall. Where do we find it? On the vessel wall. Okay, so here it is. Now, again, it's found here. What binds to it? Glycoprotein B1B. Why is that? Because it's the glycoprotein related to adhesion. That's why it binds to the VWF factor, which we find on the vessel wall. Is the first glycoprotein clear? Glycoprotein 1B. What does it bind to and its function, which is adhesion? Is that clear? Okay. There was someone specifically telling me to repeat it. So is this one clear for you? Okay. Right. This is the first molecule. The second molecule is glycoprotein 2B3A. This one, okay? We found it on every single platelet. 1, 2, 3, 4, 5. You see, it's related to aggregation. And we said aggregation, what does aggregation means? It means platelets binding together to each other, right? And as you see here, this one here and this one here, they will bind to fibrinogen, which is a molecule that will connect the two platelets, okay? So as you see here, glycoprotein 2B3A will bind to fibrinogen, and the other platelet, the glycoprotein 2B3A, will bind to the same fibrinogen, so they will start aggregating. And when they keep aggregating, they keep releasing aggregation, basically aggregation molecules and all of that to attract other platelets to come. So the thrombus will become bigger and bigger and bigger, so we basically stop the bleeding. Is this concept clear, guys? It's very important, so please, if it's not clear, I'm ready to repeat it again. I'm very free. So do you all understand it? Okay. Okay, this is the last slide in the lecture, but because it's really, really important, I wanted to emphasize on it. Thromboxane leads to coagulation, leads to aggregation, which is coagulation. Okay, prostacyclin is anticoagulation. Please, please know that prostacyclin and thromboxane are opposites. They're not the same. Wait, glycoprotein adhesion. Okay, that's a really nice way to put it. MashaAllah. Yeah, that's completely true. Good job. Yeah, exactly. What you said is exactly true. Okay. Now back to this slide. Please know this. Prostacyclin and NO are anticoagulants. Thromboxane is a coagulation molecule. Please know that prostacyclin and thromboxane are the exact opposite. By the way, in second year, inshallah, when you guys go to your second year and your POD block, you're gonna retouch on this concept, and they will teach you that prostacyclin is exactly the opposite of thromboxane. In first year, sadly, they don't teach you that. They just tell you that this is the function of this and this is the function of this. So you can't connect it in your brain. But when you go to second year, they will actually tell you inside the slides that this is the exact opposite of this function, not just coagulation function, and so many other functions. But for now, please know this. Prostacyclin, anticoagulant, thromboxane is a coagulant. Clear? Okay, now the question at the end of the lecture. Please read it and answer in the chat. Okay, let's read it together. A patient presented to the ER with heavy bleeding upon examination. It showed that his platelets are not adhering to the vessel due to all the problem with a protein that presents on the membrane of the vessel. Where is the problem? Okay. 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 Okay, so mashallah, most of you guys said that it's A, which is the true answer. So good job. But for the people who said it said a glycoprotein 1b, let me tell you why is it wrong. Okay, it's true that glycoprotein 1b is related to adhesion. That is completely true, right? That's a completely, yeah, you're right. It's related to adhesion. But the question is telling you the protein is found on the membrane of the vessel. So which one of these two is found on the vessel is the VWF factor, not the glycoprotein 1b. But both of them are related to adhesion, which is true. But only one of them is found on the membrane vessel. I mean, yeah, on the membrane of the vessel. So is it clear now? Why is it one? For the people who said B. Okay. Okay. Yeah, I'm very happy. A lot of you guys answered it right. Good job. Now, yeah, JND asked me for you guys. This is like a feedback, so you can, I think, rate me or something. It's like just one question. So please, if you can scan it and answer it, that would be a big help. Yeah, we're done with the lecture. Thank you guys all for attending. Please, if you have any questions regarding this lecture, go on and ask right now, and I will send you the PowerPoint, inshallah, on your what do they call it, on your announcement group. So you'll find my number and my email there to text me if you have any problems. You're welcome all. Wallahi, I'm so happy that I got to teach this lecture. Inshallah, you guys understood well. And yeah,